Hello, my name's Lizzie. I'm one of the midwives here at Penrice, and today I'm going to be talking you through the Birth Choices workshop. The purpose of the workshop is to talk about all your options when it comes to where to have your baby, and we're going to talk about everything that's available to you here in Cornwall. So Trellis Delivery Suite, Truro Birth Centre, Penrice and Helston Birth Centres, and the option of a home birth. So we will discuss the facilities that are available to you in each location, pain relief options, different kind of pros and cons of each choice, and more general information, kind of frequently asked questions and all of those kinds of things. My background is that I've been a midwife for almost 7 years now. I've worked in my career in all of those locations apart from Helston Birth Centre. So I've worked in Truro on all the wards in the delivery suite. I've worked on Truro Birth Centre and was really involved in the development of that. And I've worked at Penrice now for almost 3 years. I've also attended lots of home births. So I'm ideally placed to talk to you about all of those options, and hopefully by the end of this session you will feel a little bit more informed and able to make a decision about what's best for you. Okay, so I'm going to narrate our session today, so you won't see me for the whole time, but I'll be talking us through the different slides, and then I'll give us a little tour of Penrice. I'm actually in the birthing room at the moment, and we'll look at all the other options as well. So usually in this session we would start by looking at some affirmations, and I would put these affirmations on the seats and get people to read those out and introduce themselves. But as we're not doing this in person today, I'm just going to talk briefly about affirmations. So affirmations are basically positive statements, and they can be about anything, but in this context they would be about pregnancy, labour and birth. Lots of women find it really useful to use affirmations during pregnancy and also in labour, to dispel any negative feelings or worries, stay optimistic, calm and relaxed during the birth of their baby. And often people will practice with them, so you might have a couple of affirmations that really resonate with you, and you would look at them during pregnancy, say them to yourself out loud. That's really the best way to do it, every day or a couple of times a week. And then when you're in labour you would have those affirmations displayed around the room, and they would remind you that you can do it and keep you in a really positive mindset. So we've gone through the session aims briefly already, but here they are again. So we're going to talk about choices of birthplace, facilities in each location, research and recommendations about choices of birthplace, what happens when things don't go as planned, and how to help yourself during labour. We'll also talk briefly about birth preparation and birth plans. And obviously usually we would have time for questions during these sessions, so please feel free to post any questions in the comments section and we will respond to those. So choosing where to have your baby, what are the options? As I said, we're really lucky in Cornwall, or unlucky potentially, because sometimes more choice makes it harder, doesn't it? So we have lots of options of where to have babies. Delivery suite in Truro would be one. There's an alongside birth centre in Truro, which is called Truro Birth Centre. We also have freestanding birth centres like Penrice and Helston Birth Centre, and you also have the option of a home birth. So there's actually 5 options when you live in Cornwall of where you might have your baby. When you're thinking about where to deliver, you'll think about lots of different priorities, and they include safety is a really important one for most people. You want to know that you and your baby are going to be safe. Access to pain relief, especially if it's your first baby and you're not quite sure what pain relief you want to try. Location is very important, so a lot of women that choose freestanding birth centres like Penrice and Helston do so because they're close to where they live. Maybe they had a quick labour before, maybe it's just more convenient to be close to home. So that's a big one. And then finally, feeling comfortable and choice and control kind of come together. So the point of putting this in here is just to say that even if I suggest to you that home would be the safest place to have your baby, if you don't feel comfortable with that, then labour isn't going to unfold as it needs to. So it's really important that you look at where you feel comfortable, and what choice is the best for you in your personal circumstances. And to be aware that you always do have a choice as well. So even if we make a recommendation, ultimately you need to look at the risks and benefits of that, and decide what's right for you. So, national guidance. NHS guidelines recommend that for low-risk women, giving birth is generally really safe. For a first-time mum, they suggest that planning to give birth in a midwife-led unit is particularly suitable because it really increases the chance of you having a normal birth and is just as safe for babies birthed in hospital. Planned home birth in a first pregnancy has a very slightly increased risk to the baby, about 0.4%, so very small, but because of that, we don't promote home births for first pregnancies. However, we do absolutely support them, and there are lots of benefits of a home birth in a first pregnancy. You're much more likely to have a normal birth, less likely to need things like a cesarean or instrumental delivery, so you need to weigh up the pros and cons in your individual situation. For a second or subsequent baby, home births and midwife-led units are recommended, again because you've got an increased likelihood of a normal birth, low rates of intervention, and if you're having a second or subsequent baby, a home birth or a midwife-led unit is just as safe as a hospital. So you can easily find this information online, and it all comes from something called the Birthplace Study, which is a big piece of research looking at thousands of women through the UK, where they had their babies and what happened, basically. So just Google that if you want more information. So historically, childbirth has migrated really from the home into the hospital, and if you watch Call the Midwife, you'll see that in the very early series, all babies were born at home, regardless of whether a woman had a high-risk pregnancy, twins, complications, all babies were born at home. And obviously that wasn't ideal because those women who would have benefited from a higher level of care didn't receive it. However, in the more recent series, all babies are born in hospital, so we've kind of gone too far the other way. And now we have a culture that it's safer to have your baby in hospital. However, this is actually not the case for lower risk pregnancies, and recent research supports that. So to reiterate, choosing a birth centre offers improved outcomes for you and is equally as safe for baby as choosing to have them in hospital. So moving on, what does low risk mean? So we've discussed a little bit about how home birth and midwife-led units are suggested for low risk pregnancies, and that just means that you're having a straightforward pregnancy. You haven't had any complications if you've had a baby before, and you don't have any medical history. So obviously there's a lot of variation in there. Every woman is different, and there's lots of different things that could have happened in previous pregnancies or this pregnancy. So if you're in any way unsure, just ask your own midwife. We do a risk assessment for everyone at the very beginning of their pregnancy, and from that we're able to advise where it's safest for them to give birth. So speak to your own midwife for an individual risk assessment. So if we go back now to look at the different locations that you can have a baby, and just learn a little bit more about them. So first of all, we have the delivery suite down in Truro at the Royal Cornwall Hospital, and the delivery suite might be suggested to you if you're having a more complicated pregnancy, if you've had complications in a previous labour, if you've got certain medical conditions. For example, high blood pressure, a heart condition, or you're having twins, something along those lines. And that's because the delivery suite is what we call obstetric-led care. So the care on the delivery suite is overseen by obstetricians, and obstetricians are doctors who have specialist training in maternity. And we know that for women who are having complicated pregnancies, that is considered to be the safest type of care for them. So you would still have one-to-one care with a midwife in your own room, but there would be an obstetrician who's overall responsible for your care, and will be keeping an eye on how things are going, and able to kind of step in if they were needed. And that kind of care is what we consider to be safest for higher risk pregnancies. Okay, so the next option would be somewhere like Truro Birth Centre, and at Truro Birth Centre we have midwifery-led care, so no obstetricians, no anaesthetists, just midwives, and that kind of care is considered to be safest for women who are having a low-risk pregnancy. Now, Truro Birth Centre, because of its location right next to the delivery suite in Truro, have slightly wider criteria than the other freestanding birth centres. So they have more relaxed rules about who can go there. So some people who kind of sit in the middle ground and maybe have had kind of minor complications with a previous pregnancy or certain lower risk conditions it might be suggested that you could go to Truro Birth Centre as a bit of a middle ground, because we know that there are lots of benefits for women of having access to midwife-led care, and that would increase your chance of a normal birth. So where that's possible, we do try to promote that. And then we have our freestanding birth centres, which are like Penrice and Houston, and there is also one on the Isles of Scilly, but I doubt that you would be making a trip over there unless you live on the islands. And freestanding birth centres are recommended for low-risk women, so first or second pregnancy, but no pregnancy complications, no history of previous complications with other births, and no medical history. And that's because we know that being a little bit further away from the hospital, that it's safest for low risk women to go there. And it's not that we don't kind of support women who have medical conditions to birth in those areas, but it's going to be an individual decision about what's best for you, thinking about the risks and benefits of that. But as we know, for low-risk pregnancy, so for women who meet those criteria, giving birth away from the hospital is just as safe as giving birth in the hospital for them and their babies. So that's really good to know. And finally, you have the option for home birth, and home births are the same as freestanding midwife-led units, so the same sort of criteria, and again you'd be receiving midwife-led care. If you chose to have your baby at home, then you would have 2 midwives with you, and they would arrive exactly the same as the time when you would go into hospital, so when you're in established labour, to provide care for you at home, and they would stay for a few hours after the birth as well, to make sure that baby's had a feed and you're well. So it's exactly the same care that you would receive in other locations, just in your own home, which can be really lovely. We would bring all of our equipment with us. We have kind of a portable birth kit. It's quite a large portable birth kit in actual fact, with everything that you could possibly need for all kinds of emergencies, all the different drugs, and we also carry gas and air, so we can bring that to your home. So that's what we would provide in the event of a home birth. So, which type of midwifery-led unit to choose? So the slide that you're seeing now is about births planned in standalone midwife-led units and statistics for first-time mums, because we know that usually it's first-time mums that come to our classes. There are statistics available if it's not your first pregnancy, so I'll link those at the end of the slideshow. So when we look at these statistics, we can see that standalone birth centres offer women the highest chance of having a normal birth, with the lowest rate of emergency caesarean and the lowest rate of assisted birth, okay? And that's in your first pregnancy. So you are 24% more likely to have a normal birth. There's about a 25% transfer rate, say 1 in 4, and we'll talk about that a bit more in a minute. There's a 50% reduction in the need for assisted birth, and you're 50% less likely to need a caesarean when compared to starting your labour on the labour ward. Now, when we say standalone birth centres, we're talking about birth centres that are away from the hospital. So that's like Penrice and Houston Birth Centre. And by choosing an alongside birth centre like Truro Birth Centre, your chance of having a normal birth is increased by about 16% compared to labour ward. And you also have a reduced rate of emergency section and assisted birth as well, but not quite to the extent that you would in a standalone birth centre. So that's just information to help you make your decision. We'll talk more now about what if something goes wrong. So that is most people's main concern when they're thinking about where to have their baby, especially if they're thinking about an out-of-hospital location. And thankfully, I can reassure you that things going wrong is quite unusual. So when people think about transfers or problems in labour, automatically your mind will go to worst case scenario, and you'll be thinking, what if there's something wrong with the baby, and that there's a risk to them. So this next slide shows 100 women who've chosen to go to a freestanding birth centre, so like Penrice and Houston. The orange women are the women who would need a transfer, so 75 of those 100 women would have a normal birth at the birth centre and everything's great. Around 25 would need to go to the hospital at some point before, during or after their labour, but only 3 in 10 would need an emergency transfer. Okay, so the statistics for an alongside birth centre, so a birth centre that's next to the delivery suite, are a bit different. The amount of emergencies aren't different, but the amount of transfers are, and that's just because they have a wider criteria, so they have more relaxed rules about who can go there, and because of that, some women who are there have slightly higher risk factors and are more likely to need to transfer. You might also choose to go to an alongside birth centre if you know that you want to have stronger pain relief, or you want to have that option available to you. So because of that, the amount of women that are transferring for stronger pain relief is higher than from a standalone birth centre. So on the next slide, we're able to look at reasons for transfer. And again, this is out of our 100 women. So this is our 25 women who might need to go to the hospital. And you can see in the top left-hand corner that the majority of them, actually 9 out of 25, are for a slow labour. Either the first stage, which is the dilation stage, or the second stage, which is the pushing stage. And this is not an emergency. It's not kind of life and death situation for baby. It's just something that is going to cause baby to be tired and become distressed over time, and is also causing you to become tired and distressed if your labour goes on for a really long time. It can also cause damage to your pelvic floor. So we do have things that we can do about that in the birth centre environment. So we would encourage you to stay up and mobile and moving during your labour. We can provide aromatherapy and other support like that, and we can also break your waters. So we would try all of those things before we recommended a transfer, but if it was clear that the labour was very slow and we were unable to improve that, then we would recommend a transfer. So next, the next column down, a large proportion of them you can see are for an other reason. And this is a bit woolly, of course, but it's things like high blood pressure, a temperature, being very sick that we can't control with the medication that we have here. So again, not imminently life-threatening to you or baby, but just needs more monitoring and care that we can provide in a location without doctors. 3 out of 100 are for meconium, which is baby poo. And some babies poo in the waters just when they're full term and their bowels start working, but sometimes it can be a sign of stress. So because of that, we would recommend continuous monitoring, and that takes place on the delivery suite in Truro. Only 3 in 100 are for stronger pain relief, which might surprise you, but actually most women find that the combination of gas and air and the birthing pool is enough pain relief for them. And like I said, if you're more kind of open-minded about pain relief and you're not sure what you might want, then you might choose to go to the alongside birth centre, so you've got the extra option of an epidural there. And we'll go you through what options are available to you in each location on the next slide. About 2 in 100 would be for specialist stitches. So most types of stitches can be dealt with by midwives, but there are rare occasions when stitches need to be done by doctors or in theatre. So about 2% of births in birth centres are because of that. And that again is not an emergency, it's just something that we would need extra support with, so we would call for a transfer. And then we go to the 3 kind of real emergency transfers. So 2 in 100 are for excessive bleeding after the birth. And in the event of bleeding, we have lots of different types of drugs and techniques that we can use to try and slow the bleeding. So in most scenarios, we are able to manage that at the birth centre and then transfer for further kind of observation and care. And obviously if we're not able to manage that, then we can transfer for further management. But it is unusual that we're in that scenario. And only 1 in 100 would be for concerns about baby's heart rate. So you can see that it is actually very unlikely that there would be a problem with baby during labour. And that is because, as I've said before, women who come to birth centres are generally low risk. They're full term, so you should be over 37 weeks. And you've got a healthy, full-grown baby who's built to cope with labour, so they're ready for it. And labour is very stressful by nature for all babies, but they are designed to cope with it. And because we know that we're a little bit further away from a hospital, we are very vigilant and keep a really close eye on baby's heartbeat, as they would do in all locations. But we would not kind of delay if we did have any concerns, because we know that we need to act on those a little quicker. And when babies are healthy and full grown, they have lots of reserves to cope with stress in labour. So if we pick up at an early stage that they're a bit stressed, they're not really enjoying it, then we do actually have a good amount of time before we get to that point where we need to intervene. Okay, so you might have had stories about somebody who's needed to have an emergency cesarean because of problems with the baby's heart rate, and in a normal healthy labour with a normal healthy baby, it's very unlikely for that to happen completely out of the blue. Okay, we get lots of notice, and we're usually talking to you and planning and saying that might be a possibility for quite a long time before it actually becomes a reality. So hopefully that's reassuring to you. And that is one of the reasons why we would recommend, if you did have complications in your pregnancy or labour, that you did have care on the delivery suite, so that if something unexpected happened, which may be slightly more likely in a higher risk pregnancy and labour, you're in the right place for that to be dealt with really swiftly, and then that reduces the risk to you and to baby. So, pain relief options. So the next slide that you can see is looking at all the different options for pain relief in labour, and what's available in each location. So you can see that basically all options for pain relief are available in midwife-led units apart from epidurals. So we offer comfortable birthing aids like bean bags, birthing balls, and you might ask how that would be a pain relief, but there is a lot of research to show that being able to choose your position in labour really helps the amount of pain that you feel and reduces that, so that's really important. And those are available in any birth centre, Truro, Penrice and Helston. They're available on the delivery suite, and they also would be available at home, but you would need to make your own arrangements for that. We offer TENS machines, again in all birth centres. TENS machines provide pain relief by way of little electrical impulses. So it doesn't sound very pleasant, but we have sticky pads that stick on your back, and they deliver little electrical impulses into your back, which gets to your brain quicker than the sensation of the contraction, and basically confuses your brain. So it's a bit of a distraction technique, but it also builds up your body's own natural painkillers, so endorphins, and that really helps with pain relief. So a lot of women find them very effective. They don't really have any side effects. They can be put on as soon as you like. They don't slow the labour down at all, and they're totally controlled by you. So if you're going to use a TENS machine, usually we recommend that you hire one, so that you can have one at home and use it in the early stages of labour, which is when it's really useful. So you can hire them online, and they're probably about £25 to £30 for about 6 weeks hire, and they can be really effective. And we also have these available on birth centres and in hospital. If you have a certain kind of monitoring on delivery suite, then you wouldn't be able to use a TENS machine, and also if you're in the birthing pool. But for the rest of the time, and definitely in early labour, they're great. We have birthing pools available in birth centres. So we have one at Penrice, 4 in Truro and 1 in Helston. And the reason for the different kind of numbers of pools is just the amount that they've used. So Trelisk anticipate that they could have as many as 4 births a day, and it's very unusual for us to have more than 1 a day. We have about 15 a month at the moment. So if you were wanting to use the birthing pool, then it would be very unlikely that it would be occupied already at Penrice. And if it was, and if you knew you really wanted a water birth, then you could keep your options open and just decide on the day where you want to go to have your baby. There is no need to book or sort of pre-arrange when you're thinking about location. So that's good to know. Birthing pools are really good pain relief. They're a lot deeper than your bath would be, so you can submerge your whole bump underneath it, which is lovely, and it makes you really buoyant, so you're able to move around a lot easier. Often in late pregnancy you're feeling quite heavy and uncomfortable, and it really helps you to get into positions that you wouldn't be able to get to on land. It's really relaxing, and you've also got your own little bubble of personal space, so water bath can be a really nice experience. And you might wonder how a baby can be born underwater safely, and it's simply because of their dive reflex. So until they're about 6 months old, they have a dive reflex where you can put them underwater and they just hold their breath. And when they're born into water, it's exactly the same. They don't actually realise that they've been born until you bring them up to the surface, and it's at that point that they'll take their first breath. So they won't breathe underwater, and it's just when you bring them up to the air and there's lights and noises and air on their skin that they're stimulated to breathe for the first time. Okay, so unfortunately, birthing pools aren't available on the delivery suite at Treliske at this moment in time. And you would need to organise your own if you birthed at home. However, we do have one available to hire from Penrice for women in this area. So the first sort of drug option that you have is gas and air. And gas and air is a mixture of nitrous oxide and oxygen. And it doesn't take away the pain, but it dulls it. So it's a little bit like feeling drunk. You breathe it in, so you have a mouthpiece, not a mask, but a mouthpiece that you put in your mouth. And you breathe that all the way through your contraction, and then normal air when you're not having a contraction. And a lot of women find that really effective pain relief. Side effects are that it can sometimes make you feel quite nauseous and sick. However, if you work with that feeling over the space of a few contractions, that usually goes away. And we can also give you anti-sickness if you need it as well. It doesn't go through to the baby, so it's very safe in that respect, and you can't have too much of it. You can use it as much as you like, as long as you don't use it all the way through the whole time, whether you're having a contraction or not. Otherwise you'll get really high and we won't really get any sense out of you. So that's available in all locations. And we would bring it with us if you chose to have a home birth. We've got it at Penrice and Canisters and in the Wall in Truro. So next drug option is Pethidine, and that is available in birth centres and at hospital. They don't have it at Helston Birth Centre, but it is available at Penrice and Truro Birth Centre. However, you wouldn't be able to use the birthing pool after you've had it. So Pethidine is an opiate, so it's a little bit like morphine. It makes you quite sleepy and drowsy. And it does cross the placental barrier, so because of that it can also affect baby, and for that reason we don't recommend it in late labour. So if you were kind of 8 centimetres or more, we might not suggest Pethidine to you if we thought baby was going to be born soon. However, we do have an antidote we can give baby if they are born under the effects of it. Pethidine is an injection, so it goes into your leg or your arm, takes about 15 minutes to start working and lasts for about 3 hours. You can have usually 2 to 3 doses of that during labour, and it can be really effective. What I would say is that the best use of Pethidine is in early labour. So if you're having a really long early labour and you need to sleep, or if you're having an induction and you're having contractions that aren't really moving you forward in your labour but are painful enough that you can't rest, then Pethidine can be really, really helpful. We also occasionally use it if we need to do an ambulance transfer and you just need a little extra for that process. So that's available to you on the birth centre and Truro Delivery Suite. And then finally, the last drug option that you have is an epidural. So the only place that is available to you is Truro Delivery Suite, okay? And that's because an anaesthetist is required to do an epidural, and you also need a lot more monitoring when you have one. So instead of us listening to baby's heartbeat with a little Doppler, you would have straps on your tummy and what we call continuous monitoring, okay? And that's because epidurals can sometimes make your blood pressure go down, which can have an effect on baby's heart rate, okay? So epidurals come as a bit of a package, and as well as the monitoring on baby, you would have a cannula in your hand to give you fluid, just to counteract any blood pressure problems, and occasionally you might need a catheter as well, because it can be difficult to feel to empty your bladder. So when you have an epidural, it's worth thinking about that whole package that you would be signing up for. It can slow the labour down, and increase the likelihood of you needing a forceps or a ventouse delivery. However, it's the only pain relief that completely takes the pain away. So that's why it definitely has its place, and for some women an epidural is an absolute godsend, especially if you had a long labour, especially if you're induced. Then lots of women do choose to have an epidural, and it's important that you have that choice. But for a lot of women, if they're having a straightforward labour, then they very much able to cope without it. So that's information about your pain relief options. So next we have a video tour of Trellis Maternity, including delivery suite.
Hello and welcome to Princess Alexandra Maternity Wing. Today we're going to be doing a short video tour of the unit, going through antenatal, postnatal and delivery suite. My name is Emily Ridgeon and I'm one of the maternity support workers that work on the unit. There is a short stay car park just there where you can stay for about 30 minutes. You'll then need to move your car. There is parking spaces outside with pay and display, but there is obviously limited spaces, and the main car park is just outside of the main entrance to the hospital. If you are an inpatient for staying longer than 24 hours, there is a permit that you can purchase, but you have to get one of the midwives or maternity support workers to sign that at the day and take it to the Q Park hut, which is in the main car park. Right, let's go into the maternity unit. Welcome to the main entrance of the maternity unit. If you arrive at night time, you have to use the intercom system here. Press 1 for delivery suite and that will let you into the main building, and then from there you can go to which ward you're meant to be on. Okay, this is the main reception where you report if you're coming for scans. I'm now going to take you down to Will Rose ward, which is the antenatal ward. If you're coming for day assessment, that's here on your right, and then if you carry on down the corridor, it brings you onto Will Rose ward.
Hello, welcome to Will Rose. I'm Kelly, one of the midwives working here today. I'm just going to give you a tour of the unit. When you come in, you'll be introduced by our ward clerks here. This is our midwifery office. And then we have single beds. Rooms. This is one of our single rooms. So maybe you come in for blood pressure problems, induction of labour, preeclampsia, and then when we come into a 4-bay ward for induction of labour, this is the ward we'd go into. This is where you come when you've been induced and share it with, it's unusually quiet today, we share it with other women. And then we have facilities, toilets, then we have bathrooms. You can have a bath if you're induced, and we can use the birthing balls, and we can put nice lighting in to make it as relaxed and comfortable as possible for you. So we on Will Rose facilitate to work. We've got 12 beds and 3 of those are single rooms. Is our bereavement room. It's called the Daisy Suite, and it's all donated by Ella's memory, and it's actually really, really lovely under the circumstances that there are. So we have 2 bathrooms, and you can labour in the bathrooms because they're deep enough for you to labour in here. It's quite nice for pain relief when you've been induced. So visiting times are 10 till 10 o'clock at night for partners and 2 till 8:30 for everybody else. Children are welcome to come in, but obviously you've got to respect the other people in the wards. So we look forward to seeing you on our wards soon, and congratulations. Good luck.
We're now back in the main reception of the maternity. We're now going to go to the first floor to see delivery suite. You can either take the lift or the stairs to get up there. We're now on the first floor of the maternity unit. We have neonatal unit over here. That will be relocating to where Will Fortune used to be, which is just over the other side of the corridor. This is where delivery suite is, and I'll press the intercom to get in. You have to do the same for Will Rose and obviously Will Fortune, so you press say who you're here to visit and who you're here to see, and then they'll let you in.
Hello, welcome to Trellis Delivery Suite. My name's Rachel, I'm one of the midwives here, and I'm just going to show you around and show you some of our facilities here today, so we'll carry on and go in. So this is in our entrance to delivery suite. It's a tree of life with all of the hands from some of our staff that work here. It's nice just to have a bit of a personal touch and a warm welcome to the unit, and adds a splash of colour around. I'll go ahead and show you one of our smaller rooms now so you can see, and you can have a look down our corridor as well, just at the main suite. Just heading into room 5 now. This is one of our smaller rooms on delivery suite. We've got 6 here. As you can see, there's a bed, there's a CD player in the corner. You can bring your own music to listen to. There's a television in every room as well. And we also have additional birth equipment that you can use, such as this here, an inflatable cub, which is a nice horseshoe shape, and you can use it to get into different positions to enable a really active labour. Each room also has a shared toilet between the next room as well. So I'll take you around to our bigger rooms. We've got 3 of those. They're just down the corridor. Just like to follow me. So as you can see, this is the main corridor. Just a bit further down are our theatres. There's 2 of those on the unit, and then we have 3 other delivery rooms and 1 shared toilet further down on the right-hand side. So we'll just go in and look at a larger room. So as you can see, there's a little bit more space in these rooms, and they're good for multiple deliveries, and if you need a bit more space in labour as well. We've got other equipment such as the birth mat on the floor that's available. There's a good poster on the wall in each room which has examples of different labour positions that you can get into if you need some inspiration, and we've also got plenty of birth balls available as well. There's mood lighting in every room, as you can see, which is quite nice to set the tone and help you really relax in your labour. Each room here also has plenty of room for your birth partners. We usually encourage up to 2 of those per birth. So this is one of our bathrooms. We have 2 available on the suite. It's really good if you're having a low risk pregnancy and you want to use water as a good form of pain relief. We encourage all of our ladies to be up and mobile and use water if they'd like to. There are other methods of pain relief available. You're welcome to have an epidural, pethidine, and there's gas and air readily available on the unit. So just to round up, that was our quick tour of the delivery suite here at Treliske. Thank you very much for watching, and we hope to see you soon and would give you a warm welcome here on the suite.
When you come back to main reception, you then take a left down the corridor to get to Wheel Fortune Ward, which is the postnatal ward. We'll go now. Okay, we're now at the end of the corridor. If you take a right into here, this is where Wheel Fortune Ward is. So we'll go in there now and have a look. Welcome to Wheel Fortune Ward. It's now been recently located to the ground floor of the maternity unit rather than on the first floor. When you come to visit anybody, you have to press the intercom system, which is on the door here, say who you are and who you're to visit, and they'll let you on through.
Hello, welcome to Wheel Fortune Ward. I'm Lizzie, one of the midwives. We've just recently relocated to the ground floor and along the left-hand corridor rather than on the first floor like we were. We've got 25 beds on this ward, 5 4-bedded bays and 6 side rooms. So I'll show you around. So this is the nurse's desk, and just on my right here is one of the side rooms. This one has ensuite facilities, and all our side rooms are very much the same, so this just gives you a rough idea. You might be offered a side room if you're a long-term patient or if your baby's on the neonatal unit. If you've had a cesarean or you're just staying in a short time, you'll be on one of our 4-bedded bays. This is one of our 4-bedded bays. Your partner's welcome to visit you between 8 o'clock in the morning and 10 o'clock at night, and anybody else between 10 o'clock in the morning and 10 o'clock at night. We ask that it's just siblings that come to visit the baby and you here in hospital. So the other reason you might stay with us is for breastfeeding support after your baby is born, and we're all trained to a high standard to give you support with that. We look forward to welcoming you on Wheel Fortune Ward.
So that's the end of our tour, and we hope you enjoyed it, and we look forward to seeing you when you come in to have your baby.
I'm going to take you into our pool room here at Penrice for a little look around. So our pool room is a nice big room, plenty of space to move around. We actually have 2 bathing rooms here at Penrice, but because we're having build work at the moment I can only show you this one. We've got this corner over here with a bed, and we kind of keep it high up so that you can use a bathing board and lean over it. We've got chest of drawers here with everything that we need in it. Over here we've got our light box and our tea and coffee making facilities. There's also a TV just up here, and then just behind that is a toilet, so you wouldn't need to leave the room at all. The bathroom is in here if you need to use it. And then we've got a little active bath area over here with the couch and the mat. We also have a docking station which you can attach your phone to, or bring a CD, or also just Bluetooth so you can play your own music or radio. We've got our fairy lights over the pool. Really nice backdrop over there. This is our birthing pool. Lovely and deep, really good for pain relief. So it's a really lovely big room, plenty of room to move around, and you can move the bed and the furniture so that it suits you.
Go. Hi and welcome to Truro Birth Centre. My name's Dale and I'm one of the midwives currently on rotation here. So we thought we'd do a little video just to kind of explain and answer some of your questions about what happens when you first come in to our services. So what you'll do is you'll have to buzz through and you'll have 2 doors to come through. So you'll come on in and your midwife will welcome you kind of down the corridor, alright? And we'll show you into the assessment room, which is in here. So in here we will do a normal routine antenatal check, just like your community midwife would do at all of your appointments. The only added thing that we would do and offer for you is a labour assessment, which involves an internal examination. As I said, this is an offer, so you can make up your mind when you get here. Alright. If you get here and you're 4 centimetres, or you're in established labour, we'll offer for you to go into one of our birth rooms, just down the corridor. Okay.
So now I'm going to show you a couple of videos about helping yourself during labour and the importance of being upright and mobile. I hope they'll be useful for you.
Hi, I'm Siobhan Miller from the Positive Birth Company. I'm a hypnobirthing teacher and mum of 3, and I am on a mission to make hypnobirthing more accessible for everyone. Today I'm going to talk to you about positions for birth. So I use the acronym UFO. U for upright, F for forward, and O for open. So just try and remember that, UFO, upright, forward and open. So any position where you're upright, so you've got gravity on your side, will really help. It doesn't mean you've got to be standing, although standing might be comfortable, but it could be squatting, it could be kneeling, any position where you've got gravity. If you've got gravity on your side, the baby's head will be helping, it will be weighting down on the cervix, and it will help to open the cervix. If you haven't got gravity on your side, it's going to be harder for that baby to be born. Being forward is a really great position, and being open, so having your legs open so the baby can actually come out. So a position like sitting on the toilet, for example, sitting on a birth ball, a birthing stool, squatting and holding onto something, on all fours, kneeling. I'm not going to sit here and say this is the best position for you, because your baby's position and your pelvis will be different to mine. So it will be a different position for everybody. So feel free to move around when you're in labour, find a position that's comfortable for you. But always remember, upright, forward and open. Any position where you've got gravity on your side, you're forward and open, is a great position to give birth in. There is only one position which I recommend avoiding, and that is lying flat on your back. Now, ironically, that's what we see on TV. Most of the women we see on TV are on their back, and that is the single worst position for giving birth in. One, because you don't have gravity on your side, so you're having to push your baby uphill, and you don't have the weight of the baby's head on the cervix, so dilation will be slower, so your labour will be longer. You're also more likely to have an episiotomy or a forceps or von Tooth delivery if you're trying to give birth on your back. Also, your pelvis is designed to open when you're in labour, so your bones, your ligaments and muscles soften so the bones can actually move. If you're lying flat on your back, your coccyx can't move out of the way as it's designed to, so you're actually reducing the amount of space you've got. So there are so many reasons why lying on your back to give birth is not a good position. So get up, upright, forward and open. And if you find yourself in a hospital room where there is a bed, just try and use that bed to support you in different positions. So maybe kneeling up and using the headrest to support you, squatting and holding the footrest, or on all fours on the bed. Just avoid lying flat on your back. So remember, UFO, upright, forward and open, and you will be in a great position for giving birth. If you like this video, please don't forget to hit subscribe and check out the rest of my channel. If you're interested in hypnobirthing classes, then please visit www.thepositivebirthcompany.co.uk. I'll link to it below, and you can also get a free Positive Affirmations MP3 to download on the website.
So these are just a few examples of different positions that you could try using a birthing ball and also different things around your home. So for example, a chair or a bed or just kneeling on the floor. And you don't necessarily need to decide what positions you want to use in labour, but just have an idea of what could be possible and try to go with what your body tells you to do as much as possible, because women instinctively move in labour and those instincts come from the position of the baby, which tells them the best thing to do. And finally, I'm going to link a couple of different types of birth plans, so feel free to use either of those, and also some more information about preparing for your birth. And I think what's important to know about birth plans is that it's not a contract. You don't have to stick to it. We're not going to say, well, look here, you put this in your birth plan, so now you've got to do it. It's just a process of you becoming informed about what your options are, and it can be really helpful for us to know what your preferences are and the kind of person that you are and what birth you would ideally want. And that's because when you're in labour, often you don't much feel like talking. So it's really helpful for us to have a good discussion beforehand about that and get it all written down so that we can go through it with your birth partner or just review it briefly with you and have a good idea of what you want. And important things to include in your birth plan would be where you're going to have your baby, who's going to be with you, what your thoughts are on pain relief. So if you know that you're really open-minded, and if you say you want an epidural, you want us to say, yeah, absolutely no problem, then put that in there. But equally, if you feel really strongly that you want to avoid that kind of pain relief, then put that in there as well, so that we can go through kind of all the other options with you first. You want to look at whether you want to use the pool, any alternative or complementary therapies, so like aromatherapy that we offer. When baby's born, if you want skin to skin with them straight away, and skin to skin is great, have a look at the bump to baby sessions for more information on that. Whether you want delay cord clamping, so again, have a little look at the bump to baby sessions for more information. Whether you want an injection for your placenta or you want it to come naturally, and then things about how you want to feed baby and how long you intend to stay in. So at Penrice we have 2 postnatal beds. So women who, even if they haven't had the baby at Penrice, they can come back and stay with us if you need kind of one-to-one breastfeeding support or just a bit of TLC. So that's worth bearing in mind. You would also be able to stay in down in Truro if that's what you needed, and they've got the postnatal ward down there, which you saw on the tour. So that's the end of the Birth Choices workshop. Thank you for listening, and if you have any questions at all, please pop them down below, and we'll answer them as soon as possible. Take care and good luck with your birth. Bye.